And now I'll pass it over to Sam to introduce our first panel of the day.
Thanks, Patty. Our first panel will feature an exciting discussion on how to excel outside the OR and impress your residents and attendings in clinic, on rounds, or on consults. It is my absolute pleasure to hand it off to Alex and Ria, who will introduce our speakers for today.
Yes, thank you, Sam. First off, we have Dr. Eric Strauss, who is an orthopedic surgeon specializing in sports medicine at NYU. He completed his residency training at NYU and sports medicine fellowship at Rush, earning multiple awards for his research and now serving as the program director at NYU. We also have Dr. Julius Bishop, who is an orthopedic trauma surgeon at Stanford. He trained at the Harvard Combined Orthopedic Residency Program and completed his fellowship in orthopedic traumatology at Harborview Medical Center in Seattle. We also have Dr. Brooke Dickens, who is a PGY3 at Wake Forest University. She completed medical school at Loyola University Chicago Stritch School of Medicine and attended Harvard for undergrad, where she played on the Division I soccer team. And I'll pass it off to Ria to introduce our next three panelists.
And we also have Dr. Tyler Williamson, a PGY2 at University of Texas Health Science Center at San Antonio. He completed medical school at the University of Incarnate Word School of Osteopathic Medicine, attended Texas A&M for undergrad, and earned a Master of Science from UNT Health Science Center. We have Dr. Michaela O'Connor, who is a PGY2 at Columbia. She completed medical school at Giselle School of Medicine at Dartmouth, completed her undergrad education at Columbia, where she played on the Division I lacrosse team. And we have Dr. Tommy Wilcoxon, who is a PGY2 at the Harvard Combined Orthopedic Residency Program. He completed medical school at Giselle School of Medicine at Dartmouth and attended UC Santa Barbara for undergrad. Additionally, he served as battalion surgeon for the 1st Marine Division Infantry at Camp Pendleton in California. Panelists, feel free to chime in at any point, even if a question isn't directed towards you. And students, feel free to drop any questions in the chat. Without further ado, we'll dive into our first question for the day.
Yeah, thank you, Ria. Our first question will be for first Dr. Bishop, and then we'll hear from Brooke. But what are some ways that sub-Is can set themselves up for success on the very first day of their rotation?
Yeah, I guess the first day is really dictated by two things. I think hopefully it goes without saying, your own authentic brand of enthusiasm is very important to bring to a sub-I. And so, there's no success without enthusiasm. I think the thing that oftentimes slips past people is preparation. Like if you leave success on the first day to the first day, it's not going to be that successful. So you need to prepare ahead of time. You hopefully know what subspecialty you're rotating on, and you should have done some reading to prepare for that subspecialty so that you speak the language. If you show up, I'll just use trauma as an example. If you show up on a trauma rotation, not knowing the difference between primary and secondary bone healing, you're not setting yourself up for success. And that happens all the time. So the preparation ahead of time to be as familiar with the material as you can be. And then the second type of preparation is just knowing who the players are. So you should know who the faculty members are on the service that you're going to. You should have looked at their bio. You don't need to read every paper they've written, but you should have a gist of their research interests and what have you. So I think preparation ahead of time and then showing up with enthusiasm would be my two.
Thank you, Dr. Bishop. Brooke, do you have anything to add?
I think those are great points. I think it can't be understated that showing up with a good attitude is the easiest thing you can do. And some of you will be doing rotation after rotation after rotation. And that's really hard. You're in a new place with new people. Maybe you just showed up the night before. You're still really tired from your call shift that you did the last away rotation. But the things that are in your control are having a good attitude. So showing up ready to work and deciding that even if you're tired, even if it's hard, you're there to put on a show and prove why you belong there. So you got to have a good attitude and be someone they want to be around. And then being willing to work hard. You can control your attitude and your effort. That's something that a lot of us learn playing sports, and that's still true today. It's true every day of your life. So bringing those things to the table. And then, understanding that you're in a new place, you might get lost. So giving yourself extra time to get places, reaching out to the residents on the service beforehand, getting their phone numbers, having a plan for where you're going to meet them. Some of the logistical things really matter on the first day to help you be more relaxed and more comfortable and just sort of set yourself up for success. And then just being kind, introducing yourself to people that you see, telling them who you are, why you're there, that you're happy to be there. Those are just really easy things that you can do on the first day.
Those are some great answers. So a little bit more specific, our next question is, in the early morning, what are some ways sub-Is can be helpful for morning rounds without interfering too much with everyone's workflows? You want to start with Tyler? I think you're muted. I don't know if we can hear you. Um, does Michaela have anything for this question?
Sure. I think before like you start a rotation, it is helpful to talk to your resident based on whatever service you're on. And I think not comparing yourself to sub-Is on different services can be really helpful too. For example, at least for us, we have sub-Is on all different services, and the joint sub-Is do a lot of help with preparing the list in the morning. Whereas like the sports sub-Is don't do as much of that. And so I think really speaking in advance with a junior resident on your team is the most important way to kind of set the scene and how you can be helpful in the morning, because ways that other sub-Is might be helpful on their services might not actually be as helpful as you think it might be on yours. So I think it's incredibly different from rotation to rotation. So the best way to go about it, I think, is just talking to the junior resident and figuring out what will be most helpful for them.
Absolutely. I think that that's very good advice. And then just to kind of add on to that, I think that just being present is always good because things come up that aren't anticipated right before rounds. That a lot of times I love it when a good sub-I is there that I can have go and do something really quickly right before rounds when things get a little chaotic, especially on the trauma service. So just being present, even though there wasn't like any sort of communication that you had any sort of task to do, being present prior to rounds with a good amount of time, you'll end up doing something. So and being helpful.
Yes, thank you, Tommy and Michaela, for those responses. This next question will be going back to you guys and to all of our residents we'd like to hear from. But how can sub-Is be of use and stand out without overstepping with helping with consults or on call? Tommy, we'll go right back to you.
Yeah, thank you. Yeah, I think that this is a very hard line to toe. I will lead this by this is just my perception of how to do this. I did sub-Is 6 years ago because I served in the military in between time. So just take that with a grain with what I say with just my experiences as a resident and not necessarily as a sub-I. But I do understand that it's very hard to toe that line. I think that the best way to do this is to not only be present. Sometimes it's good to it's a task that's very hard to learn. It's more of kind of being able to read the room. If in fact things are very stressful, sometimes it's best to be a fly on the wall. But being present and having supplies that are available for residents or for attendings that are doing the interview is always good. So always having a pair of scissors, always having just some tape in your back pocket is always a very good thing to have. If there's a consult that comes in, especially if you're on the trauma service, I find that people who become very useful on the service are people who are very proactive. So if they hear a consult comes in, just offering to the resident, hey, would you like me to go see this patient? Is always something that I really like to hear. It's like, absolutely, I would love for you to go and talk to them, get the story, get the background history, things like that. If they need an interpreter, get the interpreter set up. Get everything set up so that it just makes the workflow that much easier for when you get down there, and having good, clear communication with your I'm not gonna say chain of command, but like with the residents to say, hey, I'm ready for you to come down, or things like that. I think that it just makes workflow that much easier.
Absolutely. Thank you so much, Tommy. Michaela, do you have anything to add?
Yeah, I have a few things to add. I think also like recognizing that sometimes like no task is too small. Like your resident might be running around and realize that they like forgot to get a phone number for a surgical patient, and like they might ask you to just like down to the ED while they're doing paperwork to get a phone number, and like that might seem like a really silly task, but for the resident on call, that can save them like 10 to 15 minutes that they get to then.
I think we're losing her. Um, I guess until she gets back, Brooke, do you have anything to add?
Yeah, I think she was saying some really good stuff. Hopefully she comes back on to finish. But I think from my perspective, when I'm working with a student, I like to know that they know how to be just a normal person. Like, do you know how to introduce yourself to the patient? Do you know how to tell the patient who you are, why you're there, and then ask him the basic questions that you learned in med school, like how to do a normal HPI? Get that information. It's really not that hard. And then reading the room. When you're working with a resident who's probably overworked and overtired and has to see a lot of people, sometimes when you're done seeing your patient, you come back to that resident and you're like ready to just rattle off everything that you learned. But understanding it may not be the best time. And so just learning sort of how to read the room and identifying some phrases that you can say, I just saw this patient. I'd love to tell you about them. Is now a good time? Um, it helps identify you as somebody who kind of is aware of your surroundings and knows that you want to give your president the information. And then it also allows them the opportunity to tell you, no, I'm really busy. Let's talk about it later. Or they can ask you specific questions, or they can say, yes, now's a good time. And they can give you their full attention and then actually understand if you did a good job, give you feedback. So that's one of the biggest things that drives me nuts when someone just starts talking at me and assumes I'm listening. Ask me if it's a good time and allow me the opportunity to listen to you. And then another thing that's really big, at least at our institution, is if you have we have Epic. And so if you can download the EMR app on your phone, so like Epic, it's Haiku, and you can use that with us while you're on call, it's huge because then you can know where patients are. You can see our list. You can take pictures of patients' wounds. Like, it's great to like document what the wound looks like. It's even better to have a picture of what it looks like in the chart. So that's really, really helpful. And then the basic things, have trauma shears on you, make sure your cell phone's charged, carry around a snack. You might not be able to stop and get food. Like, sorry, it's part of the job, but have a snack. Simple things like that. And then definitely have the phone number of the person you're working with. It's really awkward when you get lost in the hospital and then you have no idea how to find them. And then you're just wasting your time. So.
Absolutely. Thank you. Thank you very much, Brooke. Michaela, I think we lost you, but you were saying some good stuff before you lost you. Do you have
Sorry,
anything to add to what you were saying?
I'm actively on call in the hospital. Wi-Fi is a little wonky today. No, the big thing I was just trying to get at was just that like every resident's going to be different. Some will want you to write a ton of notes and prep notes for them. Some won't want you doing that at all because they have like dot phrases they really like. So I think just touching base with your resident at the beginning of the day and figuring out what is most helpful for them will help you succeed too.
Thank you so much. And last but not least, Tyler.
Yeah, I really like the point about just having a student come up and just talking to you about a patient, just because especially at some of these hospitals, there's a lot going on. And so we're managing a lot of different patients at once. And I think it just goes back to just kind of being moldable and kind of just figuring out your surroundings a little bit quicker, which is not something you can easily teach, but it's something you can learn. And something I think I learned over sub-Is was just being adaptable, understanding kind of what the rotation asks of you, not so much like trying to make this fit your skill set, but try to make your skill set fit the rotation. And that's kind of what everyone is really asking for is just come willing to work and then try to adapt to how the system works and just do your best to fit within the system. And then that's gonna become how you're the best player. Because no matter where you show up for rotations or where you show up for intern year, you're gonna have to adapt, and you're gonna have to kind of pick up new methods and kind of there may be certain ways that you think you can do something a little bit better, and as the chief resident, you can probably change that. But over the course of the next 4 years, you've got to learn to work within the system best with the other people.
Thank you all. Those are some really helpful points. So it looks like Dr. Strauss is unable to join currently. So thank you, Dr. Moqtadiri, who's the program director at GW, for joining us today. So for Dr. Bishop and Dr. Moqtadiri, how can a sub-I position themselves for a strong recommendation letter on away rotations? What's the best way to ask for one and assess its strength?
So I should go first, or how do you want to do it? Dr.
Yeah,
Bishop?
I guess I can go first. I think the first thing, the foundation for a strong letter is a strong performance. So all these things that have already been mentioned are, I think, mission critical. So showing up prepared, deep observation of the culture of the service you're on, being helpful to the resident, because the attending inevitably is going to ask the resident team to contribute to that letter. So step one is strong performance. Without that, it's hard to pass go. I think step two is just straight up asking, do you feel comfortable writing me a strong letter of recommendation? There's no reason to feel badly about that or to feel like you're burdening the faculty. That's part of the job and part of the expectation when you have rotating students. The tricky part is going to be gauging the strength of the letter without being able to read it. I think the best way to do that is to use the residents as your resource and to ask them, hey, who here is known for writing strong letters of recommendation? Who's enthusiastic about it? Who will do it in a timely manner? What you don't want to do is ask somebody who's known for always flaking out and never writing the letters, or writing a totally generic letter to write that letter for you. And that can be hard to know. So as you become closer to the residents, I think they can be a good resource.
Great advice. I think the points that I would add to that, unfortunately, sometimes it's not under your control who you have an opportunity to ask a letter for, because I think you can really just get a letter from someone who's gotten the opportunity to get to know you a little bit. It does depend a little bit on how the sub-I is structured. We try to have each sub-I spend at least 2 weeks with the same faculty member consistently. And if you're at a place where you're set up that way, that gives the faculty at least some opportunity to get to know enough about you to write the letter. Likewise, you should think about that. So on some occasions, I've had occasion where a student who actually didn't spend the bulk of the rotation with me, maybe spent like 2 days with me, asked me for a letter. And I feel awkward because I don't really have anything to say about you yet, right? Not that you've done anything bad or wrong, but so you do want to not just excel on the rotation, but invest the time with the person who you're going to write the letter with. How Dr. Bishop phrased the ask is, I think, a common and very helpful way, right? Not just, please write me a letter, yes, no, but you want to phrase it that way, that do you think you can, have I earned a strong letter of recommendation from you? Do you think you can write me a strong letter of recommendation? And I would say that anything other than an enthusiastic yes, you should be cautious about. Because what you don't want is a weak letter of recommendation in your application package. I know that can seem like a challenge when you're trying to see, I want every letter I can hang on to, and it's hard to come up with 3 or 4. But a letter that's not really glowing about you is holding the place that could be taken up by a better letter. As a reader of applications, I try to convey that advice. So it's a little bit like dating, I like to say. If you ask someone out on a date and they say they're busy that night, that might be your signal to walk away, unless they suggest a different night. right? So it's the same thing. If you ask if I can write you a strong letter and I give an equivocating response, walk away because you don't want that letter because it's not going to be strong.
Thank you very much, Dr. Moktaderi and Dr. Bishop. Our next question is for Tommy and Brooke, and we kind of touched on this a little bit, but what are some absolute necessary supplies that you'd recommend that sub-Is carry around for rounds and consults? Tommy, we'll start with you.
Yeah, so I kind of hinted on it a little bit earlier, but the same things that I carry around, I carry some trauma shears in one way or another. I have the Raptors; they easily go on my belt. It's something that I can't. It's like my cell phone. I check that I have my pager, my trauma shears, in my phone before I leave my apartment every day. I'll make sure that on the first day that they have all their badges or anything like that that's necessary to get them into all of the different rooms and closets and what have you throughout the hospital. I think also having like two types of pens. I know that this is just something that I have is to mark patients you have to have a certain color pen. So having a fresh one of those on them because sometimes a resident doesn't have it and they it frees up a good extra few minutes if you do have it on you. I have just a regular black ballpoint pen for if somebody needs it or if I need it as a sub-I or as a resident. And then I personally always have like a fine tip Sharpie marker that helps with things like marking skin that can then not wash off when when I use ChloraPrep or something like that. But those are just the things that I personally carry. But as a sub-I, I would also recommend on top of that just having roll tape in your back pocket.
Thank you, Tommy. Brooke.
Those are all great. I don't know if I have too much to add other than I've personally been victimized by fluids going in my shoe and on my sock. And so I do recommend an extra pair of socks just in your bag or with you at the hospital, just so you're prepared for that happening. And then, if you're prone to getting headaches or you're going to be tired or overworked, ibuprofen's always good to have, or Tylenol. Try to have comfortable shoes. You're going to be walking around. You might be standing on a bed helping reduce a hip. You might be, running somewhere. Who knows what you're going to be doing? And then I already said earlier, a snack. A snack goes a long way. Maybe an extra snack for your resident. Earn some brownie points. Maybe they're hungry. They see you eating your Snickers bar and they're like, oh, do you have another one of those? And you can offer it. So a marking pen, trauma shears, a tape roll is awesome. I wouldn't get too carried away with carrying around dressing supplies everywhere unless you know for sure you're going to go change a dressing. But it can just be kind of a waste of hospital resources to just have piles of them everywhere and then just randomly discard them or leave them. So some places might ask you to do that, which is great, but I don't think you as a med student need to like carry around a backpack full of supplies unless you see that, being a big benefit of the place you're at.
Yeah, actually, I think just kind of piggyback off that is carrying around supplies might not like big bucket of them might not be the greatest thing. However, if you're going on rounds or doing something and you foresee that this patient needs to have a dressing change that day, having that either on your person or going early and putting it in the room so that it's available, that saves so much time. And when that happens, I am so glad that I had the med student there do that. I couldn't even express. Rounding hurts, and so just making any part of that easier is great. I absolutely love it when med students do that because that says a few things, that they're prepared, they foresee things, they already looked at the list, they already kind of know what's going on. So I really, really, really like it when somebody does that.
Thank you for those really helpful points. So many of the students here today are currently applying for sub-internships. For those who have scheduling conflicts, what's the best way to decline NOA rotation while maintaining good relationships with the program? We can start with Dr. Moktaderi.
The simplest answer to this is lead time. But we understand how big a scheduling difficulty scheduling these away rotations are. It's hard for us. I'm juggling all the different people trying to not leave any unused opportunities on our end, but get as many people in as we can. We know the scheduling burden you're under. So I don't take offense at all to someone telling me that, the rotation that I've offered to them is not going to work out for them scheduling. But I really appreciate it if they're open about that and tell me with as much lead time as possible. If you've scheduled a rotation for us with October and in the middle of September, even though you scheduled this rotation back in, the spring, and then in the middle of September you suddenly tell me that, sorry, scheduling conflict, you're not going to be able to come. Well, that's just a waste of a rotation block on our end now because we're probably not going to be able to fill that. So just be open and transparent. And when you're making your schedule, keep communication lines open and tell us and don't wait till the last minute.
Dr. Bishop, did you want to add anything?
Yeah, I agree with that. The exact same. I think most times we probably don't remember who canceled their sub-I because of a scheduling conflict. So you just don't want to be memorable for reasons like just was mentioned for stealing somebody else's spot, not stealing, having somebody else's spot and then not using it. So nothing to add there. I think that's a good insight.
I'll just
Awesome,
add
man.
one little bit. It's okay, like we know that you're not going to be able to rotate at every program. And if I come across your application during, in September or October when I'm reading applications, and I'm like, oh, I remember this name. Why do I remember this name? Oh, yeah, this person applied for a rotation with us. That's not a bad thing. I heard that tells me, yes, you didn't have an opportunity to come rotate with us, but out of the 500 applications I'm reading, this is one who actually has already shown interest in our program. So I don't hold that against the person at all. If anything, it's helpful to know that they were interested. At least they tried to make it work.
Awesome answers. Thank you, Dr. Moqtaderi and Dr. Bishop. I also just wanted to throw it out there that if any students attending today had any questions, feel free to ask in the chat and we'll see if we can add them to the panel, or maybe some of our panelists can start answering them in the chat too. But yeah, we'll get to the next question, which is we'll go right back to you, Dr. Bishop. How can a sub-I be helpful and proactive in the clinic setting?
I thought some of the residents had some great insight into being helpful on rounds, and being helpful in clinic is the same way. Every clinic is different. Every faculty member is different. Every medical assistant is different. And so a lot of this comes down to sort of emotional intelligence, deep observation, the art of being helpful without being overbearing. And so I think the first thing when you show up in any clinic, as was previously mentioned, is you want to introduce yourself to all the participants. Typically, there's going to be a medical assistant who's rooming the patients. There might be a PA or a nurse practitioner, a faculty member, and a resident. And then you can take a minute to observe how this clinic works. Hopefully, you've asked ahead of time the resident, is this the type of clinic where I should be diving in and seeing patients? Or is this the type of clinic where I'm more of a fly on the wall to observe how things work? And so that's going to be very different by institution, by subspecialty, between individuals. And so the key to this is just being aware and adapting to your environment, because what works in clinic A might be viewed as very unwelcome behavior in clinic B. And so you need to try to figure that out ahead of time by working with the residents. And then in the moment, you need to be situationally aware and ready to adapt.
Really great advice. Thank you, Dr. Bishop. Tyler, wanted to see if you had anything to add.
Yeah, I think it just kind of goes back to the same ways you can be helpful on rounds. Just looking ahead, seeing who's 2 weeks post-op and maybe needs their sutures out or staples out, dressings down. Who's here, 3 or 4 months after a steroid injection, they were told to follow up PRN, or after 3 months when they needed another steroid injection, maybe you can start getting that stuff ready. Seeing who should have x-rays but maybe doesn't have x-rays yet. That way we don't wait and have that patient roomed and then we're waiting for them to get x-rays. You can go ahead and say, hey, I think this patient may need x-rays. Can we go ahead and get that going? Basically things to speed up clinics. And I think just one overwhelming theme that you see is, I don't think we've talked about like fracture classification or like any of this other stuff yet. We've talked about ways to be efficient and help the team. And that's honestly like 90% of being a sub-I, like whether you know exactly like what type of fracture we're looking at on an x-ray, that's not going to speed up my workflow, you getting dressings ready, helping the team in any way that you can. Those are the things that are going to speed things up. I'm going to be able to go home sooner. And then I'm going to remember that when I'm working with you on rotation, that, hey, I got off like 15, 20, 30 minutes earlier because you were doing stuff ahead of time rather than me having to do it myself.
Thank you both for your answers. So our next question is kind of related, and you might have touched on it, but what are your top tips for writing effective notes as a sub-I? What are some key elements that should always be documented? You can start with Michaela.
Sure. I mean, I think knowing what clinic you're going into is important because you'll need to like know the pertinent physical exam findings. Like a sports clinic is going to be different than a joints clinic, and the specific questions that you need to be asking in each is also going to be different. So I think having a good understanding going into that clinic of what is going to be important will help you write more effective notes. I think just making sure that your notes concisely but thoroughly document the history, but then also the notable physical exam findings. You should always have like inspection, range of motion, palpation, and a very detailed neurovascular exam is always important too. And then I think also like as a medical student, your time to shine is really to like go through your thought process in the assessment and plan, because sometimes you don't always get a chance in your like presentation to an attending or resident to talk them through like what you were thinking. But if you write it down in your assessment and plan, even if you didn't get a chance to talk to the attending or resident about it earlier, they'll see that you wrote through all your thought process too, which is just one way for you to shine.
Dr. Moqtaderi, did you want to add anything? I think you're still muted.
Sorry, I was replying to an answer on the chat. I didn't catch the question that's on the table.
Oh, we were just talking about writing effective notes and some key elements that should always be documented.
That's a whole thing in and of itself outside the thing of the sub-I, but if I can distill it to one sentence or two, your note should be clear about your thought process. And as you get better at your clinical thought process, someone reading your note should know what the patient was there for, what did you find during the visit, and what did we think at the end of the visit. Don't put extra junk in it, just make it clear.
Clear and concise. Sounds good. Thank you, Dr. Moqtaderi. Kind of going off that question, we'll go right back to you again, Dr. Moqtaderi, but how can a sub-I efficiently and effectively present a patient?
Same thought process, right? So first of all, know that when you're presenting a patient, be it as a sub-I in clinic or you're presenting a consult to not just an attending, but to your senior, the first thing that's going through my mind as the listener is, I need the big picture. I need the situation, right? Oh, I have an open distal radius fracture in the ER. Well, let me tell you about it. And then start. So now I know the framework and expectations. And now I'm going to wait for you to fill in the relevant details. And it comes with experience, what's a relevant detail. But if you start by saying, okay, I have a 43-year-old guy. Last week he was like visiting his mother-in-law, and then he has a history of diabetes. Like all of these are going in one ear and not registering because I'm wondering, what is this I'm listening to? Can you set the stage for me? So I would say all the same stuff that goes in your note, but first paint the picture for me. Tell me what it is we're going to be talking about. So I, as a listener, am not anxious and trying to see what the scope of this is.
Mm-hmm. Awesome answer. Thank you, Dr. Moqtaderi. Tommy, do you have anything to add?
Yeah, I think that this is something that I have struggled with and continue to struggle with. I think that it's really dependent on your environment. So if you're at MGH rounds for trauma, it's a lot different presenting a patient than if you are on a sports clinic. Very, very different. I think that what I personally did, like I said, I had a hard time for whatever reason, including too much information, is even as an intern, I would go to my senior residents and say, hey, this is how I want to present this. Does this sound good? And I eventually came down to like a kind of a pattern of how to do it. So I think that I would never look down on a sub-I saying like, hey, Tommy, do you want to go over, this is how I'm going to present this morning. do you think that that's good? If anything, it saves everybody time. Because if you're in a very high speed environment, you don't want to be slowed down by anything that would cause a bad attention to the sub-I. So I think that really just kind of reading the room, asking your seniors, like, is this the best way to do it? I also think that being very clear at the very beginning is something that's very good. Like you were saying, like, I have a distal radius in the ED. It's, they're distally neurovascular intact. You want me to talk to you about it. So it kind of puts them at ease about what is actually going on, and not ease, but like, things that you need to pay attention to more clearly when going into the actual thing. I always personally, every time I presented a patient, I wrote it down. At the beginning, I wrote it down. Like I said, I struggled with this. So I would write it down, the exact thing that I would say, with that pattern that I recognized early on. And that helped me to kind of have a framework. Obviously, some people are probably a lot better than me and don't have to do that, but that's just the way that I personally figured out how to go through doing that, especially when I have 15 people that I need to rattle off in a very high speed round situation in the morning. That even as an intern, I would still have to write it down and go through my list. So
I think just to piggyback on that, writing it down is a good strategy. And then you can also practice because you're going to be nervous as a rotating medical student. Everyone's going to be looking at you. So write it down and practice spitting it out. Managing anxiety, I think, as a rotating student can really help both your enjoyment, but also your performance.
Thank you all for those really helpful points. So we can go right back to you, Dr. Bishop. What are some don'ts or negative things that you've observed other sub-Is do, whether it's on call, clinic, etc.?
So I think there's lots of things that have been touched on, right? Like you want to be a pleasant person to be around. Don't be rude. Don't be selfish. Be situationally aware. I think, like some of the more subtle traps, I suppose, are lack of situational awareness, I would think would be one of the big ones. You might be a medical student that knows a ton about a particular topic. You might know more than the intern or the PGY2, but you need to be sensitive that you both want to show your knowledge and preparation, but not upset the social order by outshining those around you. And so these are like some of these subtle traps that you can fall into, where it's great that you know this information, but it may not be received so positively if it's seen as a violation of decorum. So I think a lot of this comes down just to being socially aware, I suppose I would say. I guess the one other thing I'll say, because no one ever says it, and this sort of goes with having your snacks and your Advil and what have you, is show up dressed professionally. So don't be showing up all disheveled. So tuck in your scrubs. If you have long hair, practice ahead of time how you're going to contain it in a scrub cap. Have a strategy to put on eye shields that aren't going to be all crooked and falling off in the middle of the case. Know how to put on the lead. These are all these subtle things that can really make a difference. If you show up looking prepared, you just carry an air of confidence and authority that helps to enhance your experience, I think. And so, that's just adding to the preparation element, I suppose.
And Brooke, do you want to add anything?
All of that's really good. I think something that has been a challenge for me with students is fantastic students, like y'all are getting smarter every year, which makes it hard as a resident. You're like, dang, these students know more than me, it seems. Or some of you have done research on projects and it's like really incredible and awesome. But assuming that you as the student get to tell the patient the treatment plan is a really big red flag for me, especially if the resident hasn't communicated what the plan is to the patient. And so it's really hard as a resident to kind of walk a patient off a ledge if the student's already walked them to the ledge. So as a student, you might get asked questions by patients that you want to answer, you feel like you can't answer. but understand when it is and is not your place to answer the question. And then have a phrase that you say, that's a great question. I'd like to examine you first, and then we can talk about the plan with Dr. So-and-so. Or you can tell the patient, I'd like to know your plan too. Right now, we're still figuring it out amongst our team. We'll come back and let you know. Or I don't know yet if you're going to have surgery. You may need surgery, you may not, but we'll discuss that in a bit. Like, I'll be back. Phrases like that go a long way, because I've come into scenarios where I'm, for example, a pediatric both bone where, a student has already told them they need surgery for this both bone, when a lot of us know that kids heal really well. And most of them, they just need a reduction in the ED and they get a cast, they go on their way. So that would be the biggest thing for me, is understand when it is your place to tell the patient a treatment plan and when it's not. And it's okay to ask your resident, like, hey, this is my plan for the patient I just saw. This is what I think they need. I haven't told them, but is it okay if I communicate that to the patient? Give the resident opportunity to give you permission or not.
I think that's really good. That falls under for me, the humility umbrella, like you may be smarter than Brooke and I, but we've been doing it for longer than you. And so you're not going to show up on the first day of your sub-I knowing better, no matter how smart you are. And so it's important to be humble and to be aware of that.
Absolutely. Thank you so much, Dr. Bishop and Brooke, for those great answers. We'll transition over to our last question for this first panel, and this will be for all of our panelists today. We'll start with you, Dr. Moqtaderi, but do you have any final pieces of advice or final key takeaways for students on their away rotations?
Understand that the entire away rotation is an interview, whether you're told that or not. And it's one of the most important parts of your application for those programs. And those are the programs you're investing the most in. You're literally investing a month of your time in. The successful sub-I makes all of us wish at the end of the month that they were still going to stay there. And the unsuccessful ones, within a couple of days, were ready for their month to be done, right? And so you can really shoot yourself in the foot as a sub-I. There are very few people who rotate with us as a sub-I, and during this time when I'm submitting my rank list, I'm like, they were so-so, right? You either excel and go up, or if you don't excel, you go to the bottom of the list, right? So just know that it's a very high stakes time, and you really have to be, firing at 110% temporarily, and be the person that they want to have back there. And don't badmouth the program or any other programs. This is a response to one of the other questions that was said. One of the things you shouldn't do on a sub-I is complain. Don't complain to the people around you. Don't complain to other medical students. Don't complain to the residents, because we hear that and we don't like that. You don't look good doing that.
Thank you, Dr. Moqtaderi. Dr. Bishop.
Yeah, I think that's great. I think that's great advice. I think there's been a ton of information here. I don't know if I have too much. Yeah, I don't think I have too much more to add to that.
Awesome. Yeah. Brooke.
I think the biggest takeaway I want to leave you all with is that you're applying to a fantastic specialty. Orthopedics is awesome. That's why we're here. I'm a resident. Residency is supposed to be really hard. And yes, it is. But I'm also reminded every day what a privilege it is to take care of people and get them back to doing the things they love. Don't lose sight of why you're doing this as you go through your rotations. Like, remind yourself of how impactful you get to be as a student, what an honor it is to learn from faculty, how far you've come in your journey to get here. Like, all of the challenges you went through to take the MCAT, to take step 1, to take step 2, to apply to school, like, whatever it is. And then give yourself grace in the process. There are going to be days where you wake up and it's going to be hard. And that's okay. But make the decision to show up and have a good attitude and give your best that day. Your best that day may not be the best that you gave the day before. It may not be the same every day. But you have such an opportunity to make a difference, even as a student. So don't forget that. And that difference might not even be with patient care. It might be uplifting your resident and encouraging your resident that, hey, they're doing a good job. Thanks for teaching me. You have a hard job. I'm really impressed by you. Like even just showing up and encouraging the resident who's so tired and burnt out. It's awesome to have students remind me like, wow, okay, they want to do what I do. That's great. And then the same thing, you can tell the faculty, thank you so much for teaching me. It's been an honor to learn from you. I appreciate you. Stuff like that. It goes a long way and it really makes you look good too. Like it's like creating a positive effect together. It's not like you're rotating at a program to see what you can take from it, but you're rotating there to identify if it's a place for you, but also to give back. And you can choose to do that every day.
That's some wonderful advice. Thank you, Brooke. Michaela, anything to add?
Yeah, I think just to add, one thing that we haven't really talked about is that you're often rotating with a lot of other students. And I think the times when I've been most impressed is when I get to see students work well together and that it's clear when there's like a team mindset. Because like residency really is a team sport. And so I think recognizing that the people that you're rotating with are people that are going to be like lifetime colleagues for you and people that you'll get to see at interviews and hopefully later on at conferences, and really getting to know those people too, I think can be important. And being able to work well with other students is really important. Like it is a huge red flag to me if I see like students talking over other students or correcting other students. Like even if the person that's correcting someone might be right, like it's just it's not super appropriate, it's not professional. And I think just working well together is really important.
Sorry to chime in here, but yes, that's extremely important. I think that something that we talked about a lot when we were going through and evaluating medical students this past year was there was one guy or like one group of medical students that really worked very well together, and they would even give them each other pass-offs like the night before the next rotation started. And that was huge. Like it just showed that everybody was like on the same page. It's very rare that two people, the person next to you on a sub-I is going to be your direct competition. So I think that treating it as a competition is not the move. I think that it makes it very much apparent if you do that, that you're not a team player. And I personally would not want that resident to be a co-resident with me if they're constantly trying to either screw me over or not make me look good or look better than me, things like that. Everybody looks good when they help each other out. So.
All right. Thank you so much, Michaela and Tommy. Tyler, anything to add?
Yeah, I think just going back to what Brooke said, some of you are going to be doing 4 or 5 aware rotations, and you can do a lot of what we talked about today is stuff you've probably heard at least once before, if not more. And you may be thinking, okay, yeah, but what else? And yeah, but what else can I do to like stand out? Like understand that you have to be doing this 120 days in a row. And like Dr. Motaderi said, if you did a good job at the end of the sub-I, you're kind of ready for it to be over because you worked really hard on that rotation. And so being perfect one day in a row it can be done, but 120, 150, however many days in a row, you're going to make mistakes. And we're not asking you to go above and beyond and do all of these extra things that we're not thinking of to stand out. It's kind of focusing on what your job is, your role within the team, and then executing that so that members of the team are not having to make up for you, because now you're a part of this team as the sub-I, and members of the team are not having to take over parts of your role and then accounting for time to their duties. And so really it's just executing your job, doing what is asked of you, doing it with a smile, showing a little bit of personality. Like they said, it's an interview, pretty much the whole thing. You want to show a little bit of personality, but you don't want to be buddy with everyone. And really just do what is asked of you. And yeah, it sounds really simple at the end of the day. On paper, it sounds really simple, but in the breadth of it, it can be a really difficult job. And so that's basically all we would ask of you.
Thank you so much, Tyler. And then last but not least, Tommy, if you just had anything to add on to that or.
Yeah, I think I have two things. That one of the things didn't really come up too much, but a lot of times, we get tons and tons and tons of really, really good sub-Is. And things that kind of make people stand out are things that are something that's not necessarily that has to do with the daily work. It's their personality and things like that. So what I'm trying to say is that don't underestimate the importance of if you're asked to go out after work to go and do some things like go and get some drinks with the residents, things like that, or go. I usually try to do something with on the weekends that I have off with some of the sub-Is that are with me. The last time I went played pickleball with my wife and some of the other residents and sub-Is. Is you should always take those opportunities to go, even if it feels a little weird or you have something going on. Try to make an opportunity to do that because that's the type of stuff that really gets you to the tops of at least the residence lists. Can we hang out with you outside of work? Can we be on call or in the hospital with you for 80 plus hours a week without getting tired of you? And then second off is something that I think even, well, definitely as a resident, is being comfortable not knowing things. I think that a lot of times there's very type A personalities that come through here, and people that do well are people that you're definitely not going to know everything. So there's going to be a lot of times where you don't know, and especially as an intern, a resident, a PGY2, I'm wrong every single day about something. So kind of getting comfortable within that. Not saying that you have to be wrong about everything, but if you're wrong about something, just learn from it so that you don't make that same mistake again. But it's okay to be wrong as long as, just like I said, try to learn from your mistakes. But residency is a lot of being wrong, and if you're not able to like handle that, I think you need to really think about what you're getting into. So people that tend to be looked very well upon are people who are very prepared, everything that we talked about, but also are humble enough to be able to take advice and to be wrong.
All right. Thank you, Alex and Ria. And thank you to our incredible attendings and residents for your insight and your wisdom during this panel. This panel provided so many pearls that many M4s, including myself, will carry into the next few months of sub-Is.